So NCD-free, the vision of NCD-free is a world free from preventable NCDs. But what are NCDs for those of us who aren't NCD nerds like myself? So NCDs are actually a diverse group of diseases combined by, in fact, as our wonderful comedians at the start made very clear, combined by something that they're not communicable. So you can't catch them from another person. A fairly difficult group or a difficult place to start as a definition. But these include cancer, lung disease, heart diseases, mental illness, and diabetes. But what's really important is that these 5 diseases, or 5 disease groups, are linked by common risk factors or determinants. So first of all, social determinants of health. That is, the environments in which we're born, live and grow, and the opportunities that we're afforded in those environments. Or more so, a lack of opportunities that very often, and you'll see tonight, lead to non-communicable disease. Exposure to tobacco, physical inactivity, alcohol, and poor diet. Now, I work in NCDs full-time, and one of my main occupations is trying to bust the very common myths around NCDs. And these are from the highest level right down to the politicians and the people who make decisions. So let's look at some of these myths and let's try and bust them right from the start so that you have a base understanding that far few in the world continue to have. So first of all, NCDs are not diseases of tomorrow. I hear this all the time. It's a problem of the future and it'll be a really big problem in 20 years' time. NCDs are already the leading cause of death. They attribute at least 60% of global deaths and are the leading cause of death here in Australia today. Myth number 1. Myth number 2 is that NCDs are diseases of the rich. This is absolutely not true. NCDs cause, result in and perpetuate poverty. Both globally and locally, NCDs are linked with, but also a cycle catalyst of poverty. Myth number 3, NCDs are just part of ageing. I hear this all the time as well. Oh, we've got to die of something, it's just part of ageing. This is simply not true. Half of all NCDs globally today occur in people under the age of 70. I wouldn't call that just a part of ageing. And adult onset diabetes is no longer called adult onset diabetes because we're seeing it in children. Number 4, NCDs only affect men. This is also not true. NCDs are the single biggest threat to female health and development on our planet today. And we'll hear more about this later from one of our speakers. Number 5, and this is a really big one, NCDs are just a disease of laziness. NCDs are just a disease of poor choice. NCDs are fundamentally linked to the opportunities that we have in our environment. That is the social determinants of disease, of health and disease. And this is a big barrier that we face both at the individual level, facing stigma for people living with NCDs, but also globally and getting people to buy into the prevention and mitigation of NCDs. And finally, NCDs are an impossible task. So finally you get everyone on board and you bust the first 5 myths, and so everyone's like, Sandro, it's too tough, let's do everything else. Let's do the ones that we can tackle with a vaccine. NCDs are not an impossible task. In fact, NCDs have, as Ban Ki-moon says, NCDs are a political issue, not a technical one. In 2013, we have the technical know-how, we have the resources, we have everything we need to prevent 80% of diabetes and heart disease and 1/3 of cancers. We're simply choosing not to do it. So whilst a lot of people may see NCDs as a threat, we here at NCD-free choose to see it as an opportunity. And this is where the 6 speakers tonight and the 6 speakers 10 days ago in Boston are going to try and bring you on board and show you their vision. So it's an opportunity, first of all, for bold health policy that thinks outside the box. We had a wonderful speaker in Boston, and you'll be able to access this via podcast very soon. It's an opportunity to refocus our health system on the parts that we fundamentally need to be focusing on, that is primary care and prevention. It's an opportunity to look beyond blame and stigma, stop blaming the individual for becoming unwell, and stop blaming the individual for developing NCDs. It's an opportunity, as Kate will talk later in the program tonight, to invest in our children, to invest in tomorrow, to invest in our future. It's an opportunity to catalyse social and economic development. And it's an opportunity to bring innovative health promotion programs, as we'll also see later in the program, with a Vimeo from just north of Boston, where I'm based. It's an opportunity to build stronger and more effective investment and economies through cost-effective investment in health and healthcare. As Fred will talk about, it's an opportunity to leverage technologies for the health of millions. It's an opportunity to pull populations out of poverty and break the cycle of poverty that NCDs perpetuate. It's an opportunity to reconnect with our food supply, as one of our speakers will talk about, Shauna, who's flown down from Sydney. It's an opportunity to build happier and healthier cities, instead of cities that are conducive to disease and then giving people, wielding the stick when people become unwell. And Lucinda will talk about this in a moment. And finally, it's an opportunity to empower communities through and for health. These are the opportunities that we have if we choose to tackle NCDs. So this is the vision that we have at NCD Free, and we hope that you'll join us by the end of the evening.